Hello, I am Michael A. Weiss, and welcome to the Healthcare Interview. Today we are honored to have the man and doctor behind KevinMD.com, Dr. Kevin Poe. Do you envision a day when the physician house call is revived through technology and maybe even by like a Skype video phone call? Do you think there will be a day when that will happen and health insurance companies will actually embrace it and provide reimbursement for it?
I think that eventually the doctor-patient relationship is going to evolve where we don't necessarily have to see patients in the room, in the exam room. I think the way health policy is right now, it's slowing down that evolution, because even though we have the Affordable Care Act, a lot of the reimbursement only comes from a face-to-face visit. And there's a lot of encounters that don't necessarily need a face-to-face visit. For instance, if I take care of a patient that I know well with hypertension or diabetes, I don't necessarily need to see them in the office. I can manage that remotely, whether it's on the phone or through a virtual chat. You mentioned these virtual consults. I recently did an op-ed in USA Today talking about that, and I actually came off pretty negative because I don't think that it's quite ready where we can see patients we don't know. And I know some insurance companies are setting up these virtual chats or virtual consults for acute visits and taking care of patients that patients haven't seen before. And I don't think it's quite ready for that type of visit. I do think eventually we can see patients that we know already, and we can help fine-tune and manage their chronic disease through a virtual forum like Skype. A lot of it's going to depend on how quickly we can get away from the fee-for-service payment model, meaning that we want to get away from being paid per visit and rather be paid globally. And with the Affordable Care Act, they've instituted what's called accountable care organizations, which is going to change the way doctors are being paid. But that evolution is going to be very, very slow. I don't expect anything instant like with anything else in healthcare. But perhaps in the next 5 to 10 years, we can come to a point where we don't necessarily have to bring patients into the office anymore and utilize some of these other alternative ways where we can interact with patients.
In our pre-interview communications, I informed you of my latest project called the Crohn's Disease Warrior Patrol, which is basically a hospital patient visitor ambassador program for veteran Crohn's patients to visit with new Crohn's patients, either newly diagnosed or patients having a rough time in the hospital. And it's premised on what I believe is a truism as a patient, based upon my vast experience, that patients helping other patients is the best medicine. Well, the February 2013 issue of Wired magazine, which looks like this, has a very interesting article in it called Dr. Feelgood, and it's written by a Nathaniel Johnson. And the subheading is, "Science shows that one of the best medicines is something few physicians dispense, a little TLC." Now, I believe, Dr. Poe, that physicians don't dispense tender loving care because they can't. I mean, there's so many constraints on their time and quotas and what they have to do, all dictated to them by health insurance companies. But what are your thoughts on this seemingly new patient-centric focus in healthcare?
Well, I agree with your assessment. I think that doctors definitely want to give more tender loving care than they currently give. And it's because of the system that a lot of us practice in. And I talked about a little bit about that in my last answer, about the time constraints, the regulation, the bureaucracy. Some doctors are under quotas in terms of number of patients that they have to see for each session. And I think that beats a lot of that tender loving care out of them. But I do see some encouragement on the horizon, because hopefully if the way practices can change, where communication with patients is emphasized rather than just seeing more patients, I think that will eventually turn the tide towards more patient-centric care. And perhaps encourage doctors to communicate better with patients, not only spending time with them in the exam room, but also communicating them with a phone call or through electronic means via email or whatever virtual chats may be coming down the pipe. And hopefully in the future, in the next 5 to 10 years or so, as our healthcare payment system evolves, we can definitely take a few steps towards that model.
Personal technologies like the iPad mini and smartphones are changing the patient experience and also the way in which doctors practice medicine. Can you explain this trend, and do you think it'll make healthcare more efficient and thus more affordable to more people?
The answer is yes. I think that mobile technology is going to be a game changer when it comes to healthcare, both from the physician side and the patient side. And I think that later on we're going to talk about some patient applications of mobile technology. But when it comes to the physician side, I absolutely think that tablets and smartphones, they're definitely going to make a difference. If you look at some latest studies, the number is almost 90 to 95% of doctors have mobile technology. And it's incredible that we have the ability now, just on our mobile phones, to tap into our electronic record systems, pull up a patient's chart. We can fax in prescriptions just straight from mobile phones wherever we are. So this is leading doctors to become untethered from our laptops. We can step outside the exam room and still practice medicine. I bring mobile technology into the exam room on my tablet or smartphone. You could pull up drug information, and you could look up drug interactions. You can show patients pictures of pills that they're taking. You can go straight to the web and go to a variety of mobile sites and give patients what we call point of care or instant information, whereas before they would have to wait for that information. So from a physician standpoint, I do think that this mobile technology is one of the ways that we can transform the doctor-patient relationship. And I think the only thing holding us back is just the fact that a lot of our practices just haven't quite adopted it yet. Less than 50% of practices have electronic medical record systems, let alone systems that can talk to tablets and smartphones. So we have a lot of room to work on, and I think in the next few years, as more practices get these systems, and the next step would be to connect them with our mobile devices so we can practice medicine and tap into some of the patient charts when we're not in the office.
Are there any medical or healthcare mobile phone applications or apps, as they're called, that you could recommend to patients, for example, who are trying to manage chronic illness or their health, or maybe mobile apps that you could recommend to physicians who could benefit maybe from an efficiency perspective?
As you know, there's thousands of mobile apps that are marketed towards patients. The most common apps are these health tracker apps, a lot of fitness apps that can use the GPS on your phone to track how fast you're running, how many steps you're taking, how many calories you're burning. And I think that these tracking apps certainly are definitely very helpful. And there are also apps where patients can take diaries, whether it's a migraine diary. They can write down the symptoms or the conditions that they're around it, whether they have headaches. There are various food diaries as well. I think the bottom line is that there are a lot of these health apps that's giving patients more data about themselves. And I don't have any specific ones, but I think that in general, there's not a lot of studies that show that one app is better than the other. So right now, I think we're in the early stages of mobile health, and until this shakes out and we have definitive studies that show that one app's better, I'm just going to recommend apps that help them the most, whether it's diet apps or exercise or fitness apps or diary apps. I do think that one area that mobile apps can help would be in the area of medication compliance. Studies show that less than half of patients take their medications as directed, and I think that's a huge problem. And I know that there are a group of apps that help patients remind them which medicines to take and when to take them. There's these virtual pillbox type apps that can send text messages out that can even make it a little game. Whenever you take your medication, you can get points. Whatever way patients can take their medicines as directed, I think is a huge thing, because medication adherence, I think, is a big problem when we treat patients. So that's on the patient side. On the medical professional side, I use an app called Hippocrates, which is my PDR or drug reference at my fingertips, and it's also useful in the exam room because you can punch in other medicines that patients have, and they can see whether those medications interact. I use an app called Up to Date, which is a virtual medical reference. And then there are a couple of non-medical apps I think are tremendously useful. Evernote, I think, should be an app that everyone should use, because whether you have a thought or find something on the web, you could put that in Evernote and you can access it through a variety of devices. And I use Dropbox. And again, I think Dropbox is a great app for both patients and professionals alike. What I do from a physician standpoint is whenever I read a health article or a journal article that I want to save, I can save it in that virtual Dropbox, and it can be accessed anywhere, whether it's my mobile device or my various computers, both at home and work. So those are some examples of various app categories and specific apps to physicians that I can recommend.
You mentioned the Affordable Care Act earlier. For argument's sake, let's refer to it as Obamacare, because that's what everyone seems to know it as. When Obamacare was passed, it was my contention that whether people liked it or didn't like it, I thought that it was intended to really address these gross inefficiencies in our healthcare system, and I thought that would lead to entrepreneurial opportunities. Smart people who would come into healthcare to try to fix these gross inefficiencies because there's profit in it. And I think that's happened. So what are your thoughts on the effects of Obamacare and on this seemingly increase in entrepreneurial healthcare ventures?
When it comes to our healthcare system, there's so many problems with it. We have over 50 million people who are uninsured. We have rising healthcare costs, which left unchecked can reach 20% of our gross domestic product. And I think there's a lot of inertia against that, and you could tell by the fight that Obamacare had, not only in Congress, but also in the Supreme Court in order to get it passed. And in effect, Obamacare is a pretty moderate proposal because it keeps the current health insurer system in place. So, and its origins were actually on the conservative side from the Heritage Foundation back in the 1980s. The way I frame Obamacare is that it's better than nothing, because if nothing was done, I think that our healthcare system was headed to ruin. And whether the Affordable Care Act or Obamacare works, I think, is really undecided right now. I think a lot of its cost control mechanisms are piecemeal, but it does do the one goal of covering most of the uninsured, and I thought that was a tremendous problem. So its effects remain to be seen. I don't quite think it has enough teeth to control our healthcare costs, which is going to be the primary problem in whatever direction our country goes in, and we'll see how that works. So in terms of increasing the number of entrepreneurs in healthcare, there's not too much I can comment on that. I know that talking to some other physicians, they're frustrated with the regulations that Obamacare had given to them. They're leaving medicine altogether. They're leaving Medicare, and that gives them some of the freedom to practice some ventures outside of medicine. So I think that in one way they're not happy with the new regulations that the Affordable Care Act placed on them, but it also gave them the opportunity to pursue some of the interests outside of clinical medicine. And I think that that's good too, because the bottom line is that we need different approaches to solve our healthcare problems. It can't be a progressive approach. It can't be a conservative approach. It needs to be an approach where we blend ideas from